Welcome to this important discussion on chronic constipation. Often dismissed as just a minor inconvenience, it's actually a chronic and debilitating condition for millions. Its impact extends far beyond simple discomfort, significantly impairing quality of life and surprisingly, contributing to a wide array of serious health problems. We'll explore how chronic constipation is intricately linked to various bodily systems, often creating insidious, vicious cycles that can exacerbate existing conditions and even spawn new ones. Let's start by understanding why chronic constipation occurs. It happens when stool moves too slowly, allowing the colon to absorb too much water, making it hard and dry. Lifestyle factors are among the most common culprits. A diet low in fiber, from fruits, vegetables, and whole grains, is a prime reason, as fiber adds bulk and holds water. Not drinking enough fluids also causes dehydration, leading to hard stools. A sedentary lifestyle slows gut motility. Many people also inadvertently contribute by ignoring the natural urge to defecate, which can dull signals over time. Even changes in routine like travel or stress, and diets high in processed foods or low in fiber, can disrupt healthy digestion. Beyond lifestyle, medication side effects are significant contributors. Opioid pain relievers are notorious, and many antihypertensive medications like calcium channel blockers and diuretics can also slow bowel movements. Other common culprits include certain antidepressants, antihistamines, antacids, and iron supplements. It's crucial to review your medication list with your doctor if you're experiencing chronic constipation. Moreover, constipation can be a symptom of underlying medical conditions like hypothyroidism or diabetes due to slowed metabolism or nerve damage. Neurological disorders, specific gastrointestinal issues like IBS-C, and even normal physiological states like pregnancy and aging, can all play a role. Our bodies rely on a delicate balance of electrolytes, like potassium, sodium, calcium, and magnesium, for vital functions, including muscle and nerve activity. Disruptions in this crucial balance can both cause and intensify constipation. Electrolytes are indispensable for proper muscle contraction. When levels are askew, particularly with deficiencies in potassium or magnesium, the smooth muscles of the digestive tract can become sluggish, directly slowing down peristalsis. Conversely, high calcium levels can also dampen gut motility. Electrolytes are also key regulators of the body's hydration status. Dehydration, a common factor in constipation, can result from or be exacerbated by electrolyte imbalances, leading to harder, drier stools. The relationship between high blood pressure and constipation is a classic example of a vicious cycle. Hypertension can fuel constipation primarily through medication side effects, with many antihypertensive drugs directly slowing bowel transit. Both conditions also share common lifestyle factors. Conversely, constipation can dangerously aggravate hypertension. The most critical link is the Valsalva maneuver, where straining to pass stool dramatically increases intrathoracic pressure, leading to sudden, sharp blood pressure surges. For someone with pre-existing hypertension or heart disease, this spike can trigger serious events like arrhythmias, heart attacks, or strokes. Additionally, alterations in the gut microbiome due to chronic constipation might also influence blood pressure regulation. Patients with congestive heart failure are particularly vulnerable to constipation. Their medication regimens often include diuretics, which can cause dehydration, and other drugs like opioids or beta blockers that slow digestion. The physiological impact of CHF itself, with reduced cardiac output and fluid retention in the intestines, directly impairs gut motility. Lifestyle limitations such as fatigue and shortness of breath often lead to reduced physical activity and lower fluid or fiber intake, compounding the problem. Most dangerously, the Valsalva maneuver from straining significantly stresses a weakened heart, potentially exacerbating CHF symptoms and increasing the likelihood of hospitalizations. The repetitive physical stress of chronic straining can lead to significant structural damage within the body. Hemorrhoids are common, resulting from increased pressure in anal veins. Hard, dry stools often cause painful anal fissures, tears in the anal lining. Severe or prolonged straining can weaken the pelvic floor muscles, leading to rectal prolapse, where part of the rectum protrudes. The immense increase in intra-abdominal pressure from straining is also a major risk factor for various hernias, including inguinal, umbilical, hiatal, and incisional hernias. Finally, chronic straining and high colonic pressure are believed to contribute to diverticulosis, the formation of small pouches in the colon, which can become inflamed, diverticulitis. The pelvic floor is a vital group of muscles that supports pelvic organs and is crucial for bowel control. Here, we see another vicious cycle. Often termed dyssynergic defecation, pelvic floor dysfunction can directly cause constipation when these muscles paradoxically contract or fail to relax properly during a bowel movement. This prevents smooth stool expulsion, even if the stool is soft. Conversely, chronic constipation can cause or worsen PFD, forceful, repetitive straining to pass hard stools physically damages, weakens, or overstretches these vital pelvic floor muscles and nerves, disrupting their normal coordination and perpetuating the cycle of difficulty. While we've discussed general chronic constipation, it's crucial to acknowledge irritable bowel syndrome with constipation, or IBS-C. This is a functional gastrointestinal disorder primarily defined by recurrent abdominal pain that is associated with constipation, often improving after a bowel movement. Its key features include altered gut motility, visceral hypersensitivity where gut nerves are overly sensitive to normal sensations, and gut microbiome dysbiosis. Patients commonly experience chronic constipation alongside significant abdominal pain, bloating, and gas. Management often requires targeted approaches beyond general constipation remedies, including specific dietary modifications like the low FODMAP diet, specialized medications, gut-directed therapies, and psychological therapies to address the complex brain-gut connection. The impact of chronic constipation extends even further, beyond the direct physical complications we've discussed. One severe complication is fecal impaction, where a large, hard mass of stool becomes stuck, potentially leading to bowel obstruction or even perforation if untreated. More broadly, the persistent abdominal pain, bloating, discomfort, fatigue, and constant worry about bowel movements can profoundly affect daily activities, social interactions, and overall mental health, leading to reduced quality of life, anxiety, and depression. While the link is debated, some theories also explore a potential connection between prolonged stool contact due to slow transit time and an increased risk of colon cancer. Given the far-reaching consequences, chronic constipation should never be ignored. Effective management is crucial and involves a multi-pronged approach. Foundational strategies include dietary changes, specifically increasing both soluble and insoluble fiber gradually to avoid bloating. Adequate fluid intake is essential, as fiber needs water to work effectively. Aim for at least 8 glasses of water daily. Regular physical activity, even moderate walking, helps stimulate the natural contractions of the intestines, aiding stool movement. Finally, a thorough medication review with your healthcare provider is critical to identify and potentially adjust any drugs contributing to your constipation. Beyond foundational lifestyle changes, more targeted strategies may be needed. Various laxatives can help, but should be used under medical guidance. These include bulk-forming agents that add volume, osmotic laxatives that draw water into the colon, stool softeners, and stimulant laxatives for short-term use. For issues like dyssynergic defecation, pelvic floor physical therapy is highly beneficial, often utilizing biofeedback to help you learn to relax and coordinate your pelvic floor muscles correctly during bowel movements. And crucially, if constipation is a symptom of another medical condition, addressing that underlying condition directly is fundamental to resolving the constipation itself. In summary, Chronic constipation is far more than a mere inconvenience, it's a significant health issue with profound and far-reaching systemic impacts. We've seen how it creates vicious cycles that worsen conditions like hypertension, heart failure, and pelvic floor dysfunction, and causes direct structural damage. Crucially, we've delved into the myriad of factors contributing to it, from lifestyle to medications and underlying medical conditions. Understanding these diverse causes is the essential first step toward effective intervention. The good news is that recognizing its gravity, coupled with this understanding, empowers us to act. Proactive and comprehensive management strategies are vital, involving a multi-pronged approach from diet and fluids to specific therapies and addressing underlying conditions. Ultimately, taking chronic constipation seriously isn't just about regularity, it's about safeguarding overall health and enhancing long-term well-being. By embracing this holistic approach, we can break its detrimental cycles and significantly improve lives.